we have people here to give you the state information, and we have someone here today to give you an out-of-the-box, nuts and bolts, here's how you do it, and how to get it up and running very quickly, all right? But before we start, I want to take a minute to thank the person who has pulled this together. Diane Polachek is a very long-time member of NYSPA. She has been the president of NYSPA. She has been the representative to APA. She has championed psychology in every way we can. This workshop is her idea because she wants to create a series of workshops to help psychologists transition. And she has fought and pushed and made me work my ass off to get this thing together, all right? So I won't say that she did it all by herself, but she pushed like crazy so that the rest of us would get it done. So I want to thank you, Diane, because I think this is
I can't thank Pat enough. She did the lion's share of the work, believe me. Okay, so I'd like to start now by introducing our first speaker, who is Dr. Peter Oppenheimer. It's my great pleasure to introduce you to him. Dr. Oppenheimer received his PhD in clinical psychology from the University of Virginia School Clinical Child Psychology Program. After an internship at SUNY Health Center in Syracuse, New York, and work in clinics and private practice, he co-founded File and Oppenheimer Psychological Services, where he still works. His clinical work is focused on children and families. Dr. Oppenheimer is the current president of the Rhode Island Psychological Association, where his interest has been on legislative and policy advocacy. Dr. Oppenheimer is active in the American Psychological Association, where he served as representative to APA Council from Rhode Island, and he is currently a member of CAP, the Committee for the Advancement of Professional Practice, where he is a strong advocate and outspoken champion for psychologists in independent psychotherapy practice. He is currently chair of the Rhode Island Board of Psychology, of which he's been a member since 2004. 4 years ago, Peter began to work to establish an IPA so that psychologists in his state could survive in the era of healthcare reform. He and 3 other Rhode Island psychologists spent countless hours, along with primary care physicians, to eventually create a collaborative care network for primary care physicians, mental health professionals, and health facilities, which is able to provide care for mental and behavioral health conditions and substance abuse problems. And he's going to tell us more about this. Dr. Oppenheimer.
Thanks, Diane. We go back many years to council and a number of fights around state associations and practice. And she's been wonderful support and great ideas, and it's nice to hold this together. Can we turn on the projector?
How do we do that?
Frank, how do we turn on the projector?
Is there an on button?
Oh, it's right there, power button.
This?
Yes.
It's not pointed at the screen.
Yep, that should be on.
Does that look? Lesson number 1 about this: everything is harder than it has to be.
That is true.
It says it's on.
And
It says it's on.
Lesson 2 is it takes longer.
Does it take a while to warm up?
It does.
It does take a while. Oh.
Well, this new person can sign in fast.
I think we're not good. Had you tested?
No, it's gone.
Did you test it, Frank?
Is it going now?
Yeah.
Well, it's gone.
No.
Yeah, there we go.
Let's see.
It's tiny.
We need to.
Your focus.
It's slow to wake. Not unlike the rest of us.
I
Just a point of clarification, this is going to be taped, so you don't have to take copious notes?
Well, the DVDs are gonna be for sale for the upstate members that couldn't make it today. Okay, I don't know how many I'll be able to pull together. So, but there will be PowerPoints you can download, right, Mike?
Yes.
Yeah, and
Yes? Yes,
I can post mine.
yes, the PowerPoints will be posted for you to download.
For one presenter?
What?
For all the presenters or one presenter?
For Peter and Mike,
Okay, thank you.
okay?
Let me see if I can angle this so it's
Here, how about a book?
Would you please move the podium a little back?
I think it would get straight into 2 minutes.
It's gotta have the right book.
Maybe the building isn't straight.
That could be. It's making it worse,
No, it's better.
No, it's right there.
okay?
Good.
hopefully the color will get better as we warm up.
It's good enough,
Okay, sounds good.
there you go. All right?
That's flat enough?
Yes,
Okay, good.
okay?
Right. Okay. Sometimes efforts to implement healthcare reform seem like a hard act of magnificence sketch, that we know the answer we want. The politicians have come up with this idea of the triple aim. And we're trying to figure out what are the right questions to ask. And what are the pitfalls and barriers that are going to get in the way of trying to come to that answer. So this may be the triple aim, but there's really no clear way to achieve it. And it's not necessarily as feasible to do